Today. I want to wish everybody a happy new year. It's going to be a fantastic new year. Very excited about all of the things that we've got going on with the Affordable Care Act, and a lot of the hurdles that we've been dealing with on a regular basis. Are really starting to get cleaned up. A few conversations with some of the agents this morning. People are getting their phone calls in order to make their payments. We're going to go over some of those payment methodologies that you can utilize to have your clients make those payments that they're looking for. As you know, as of today, we are working on a 2/1 effective date for Affordable Care Act plans. But before we get into any of those details, what I really want to do is I want to make sure that everybody's aware of the tools that you do have at your fingertips. And these tools really need to be accessed on a regular basis. The first tools that we're going to talk about is our training channel. On YouTube, I know that Gigi sends out to you a lot of our new videos when we come up with them. We do try and stay on the forefront of education and making sure that you have access to all of the information. We're going to be covering them in our weekly calls like we're doing today. But a lot of the in-depth processes that we're going to talk about are available on our YouTube channel. So get to the YouTube channel. You can type in my name. I know that you've gotten a bunch of these videos. Subscribe to the channel. That way, every time we put up a new video, you'll get notification of this. Those of you that have been having a hard time using the direct link, there is a video that goes over that, a whopping 6 minutes in length, shows you how to troubleshoot the direct link and how to use that. Also, those of you that are new on this call, or those agency owners that are on this call today, really want to make sure that all of your agents have utilized the Skillsoft training from Florida Blue. This is going to give everyone a really solid foundation in understanding ACA plans, ACA processes, what is subsidy amounts, and all of the real foundation and core foundation that at this point I would assume everybody's got. But in looking at that, we also have to make sure that you do have that foundation. We'll be checking to make sure that you've completed that Skillsoft training, and it really is it's a manner for you to make sure that you've got the foundation built so we can build off of that. I am prepared and really want to start doing some more advanced ACA training when it comes to conversation training and things that you should be talking about with your clients in order to make that sale. And that is not going to happen unless you've got that foundation built. If you go through this channel, take a look. It talks about healthcare.gov from Florida Blue, that direct link. Those of you that sold Medicare, there's some information on vision provider searches for Medicare, telephonic process for Medicare products as well, because this was in the knee deep in the provider directory in the Medicare sales that we were dealing with. Additionally, those of you that haven't spent a lot of time on the Affordable Care Act, it would be good advice for you to go through the healthcare reform for clients, and then just really kind of peruse through some of these other videos that are here. As you're starting to get comfortable with the products and you go through that Skillsoft, some other additional training on the healthcare reform release on when the plans came out, we did a video on that. So really just make sure that you go in, you take a look at these, and make sure all of this stuff is completed. It really just helps both Gigi, you're the agency owners, and everyone. Just gives you another area that you will go over and repeat this stuff over and over and over again. And really, it's there for you to access. So it's a good tool. Make sure that you're using it. The first thing I want to talk about today is getting through search accounts, making sure that all of your information is in search accounts. I don't think a lot of you are really familiar with search accounts and the search accounts process. So I want to touch on that really quickly. This is going to go for all sub-agents as well as agency owners. When you're going through this process, you just have to be conscious of how you're logged in. You'll click on the search accounts button, and then you won't have this option. But for example, if I was looking at a particular agency, and then you have the option for group or individuals, you click on individuals, and all of your clients should be listed in the search accounts. Now, they will be listed in search accounts after a premium payment is going to be made on an Affordable Care Act plan. So when you're looking at these, this is where you're going to be able to see all of your business. Now, you can search this by name or contract number. So, for example, if you were looking for Mr. Smith, you would just type in Smith, and then this is going to bring up all the policies that you have that are associated with Smith. And when you get in here, you can actually click on this button right here. This button right here will actually give you a little bit more information about the policy, about the information that is all there. Okay, now it also is going to reference the H number. This H number is the policy number for the client, and the reason why that's important is because you can give that to your client. Now, if you don't see your client represented in search accounts, then you are going to need to call Florida Blue Agent Services with the appropriate information on that client, and you're going to ask them exactly what is going on. Do they have the application? What's the status of the application? Is it pending a CMS approval? So if we're talking about Medicare, then you're going to have to deal with those areas first. And really find out what's going on. You're going to be given a reference number at the end of that call, and your agency owner will need that reference number in order to troubleshoot premium payments or assignment of that policy. For agency owners that are having these issues, that can't find these applications, after your agent or you go through that process, check, see what the issue is going to be, and then you get that reference number. Many times there is just something simple as if they couldn't read something on the application. You should troubleshoot that and get that accomplished. Additionally, when you make that call, let me ask everybody, just do yourself a favor. Get a list of applications that you need to address and make them in one call rather than keep on calling back, and calling back. It's just a much better use of your time. A lot of this cleanup should have been done after the 7th. I know that a lot of you on this call have taken care of this cleanup already, but now this cleanup is additionally going to be addressed when it comes to Affordable Care Act. Now, with the Affordable Care Act, those policies are taking a little bit more time to show up in search accounts, and that's because of the payment issues, because they will not be able to, and they will not show up in search accounts unless they've made a payment. The payment has been received, and that payment is done. Now, if your client had provided payment information when you did an application on the Affordable Care Act, you will also need to ask your client if they have drafted said payment. Believe it or not, there's been a lot of applications that have been processed that there was no payment taken. So therefore, just check with your client. Ask them, can you check your account, make sure they've taken the money. And if they haven't taken the money, then you're going to want to take the steps that we're going to cover next in making the payment. I got a question that came through. Let me just address this. I still can't confirm if some of my clients' applications have been enrolled. All it states in Access Blue is enrollment complete. Agent Services seems to be having trouble confirming it also. How can I let my clients know if they're enrolled, and how can I get them a temporary ID card if no H number has been issued? Well, I think I answered that, but let me just go through it one more time. I'm making the assumption that this is an Affordable Care Act program, so we are looking at the Affordable Care Act plans. Now, what we're referring to when you're talking about this is you really need to look, and what you're seeing is in your individual sales tool under My Applications is where you're seeing complete submission. Now, as long as you have a complete submission here and you have been referenced and issued a app identification number and it says complete submission, then you could rest your mind at ease knowing that it is going to be processed. However, for this particular situation, what you're going to need to do is you're going to need to, as you did already, it seems, call Agent Services and ask them to collect a premium payment, because it seems as if there's no premium payment that has been collected. Now, if you have this email that looks like this, you should have gotten it right from Blue Cross. We did send this out to all of our agents and agencies as well. This email shows two different options that you have for making premium payments for those clients. So what I would suggest is, if the money has not been taken, for you to follow the instructions in the binder payment process and make sure that you do two things. All right, so listen up here and pay attention, because this is very important. The first option that you have is for your clients that you used your Social Security, or their Social Security, number when you completed the application. Then what you would want to do is use the online payment option. Now, the online payment option, you would click on the link. The link is going to bring you to a screen that looks like this. You're going to see member login, username, and password. Now, this works 99% of the time as long as there was a Social Security number that was issued or used when the application was processed. Now, at that point in time, they'll click on member registration. They will use the last 4 digits of the social because they will not have the policy or certificate number, their date of birth, and their zip code. They will follow the prompts through here, and then they will make a binder or premium payment. Now, those people who made that binder or premium payment with the application don't have to follow this process unless they're alarmed that they haven't taken the money, what's going on, and they're one of those clients who really want to pay, which is understandable. Then they can follow this process. There is the potential that it could be a duplicate payment. That money will be applied to the policy for the next month, but at least that way they know that they've made premium payment. 24 to 48 hours after that premium payment has been received, then you will be able to go back into Blue Cross and you will be able to print a temporary identification card. Now, the process for printing a temporary identification card is rather simple. If on the main screen, you will see a button here that shockingly enough says print a temporary identification card. At that point, you're going to have a couple of different options. You can access it with social and date of birth combination. You can also use name and date of birth combination, or if you have found said client in the search accounts, you can use their H number. And then once you make that selection, you will actually say benefits in effect at this time or a future date. And then it will bring up your temporary identification card for that client. Agency owners, you are able to do this on behalf. Anyone can print a temporary ID card for anybody. So it's not locked into just your clients. You can help anybody out if it's a friend, a family member, somebody else that you know. You have that opportunity to do so. It does not have to be just your client. So that's how you're going to print the temporary ID card. Again, that's a good way for you to check if everything is done, is to just go in there and try and print that temporary ID card as well. Now, the other option that you have is really what I would suggest is for your clients that are very adamant about making payment, what you're going to do is you're going to follow the following process. You are going to get a list of the clients that need to make a premium payment. Now, again, we are really asking and suggesting to everyone that all of your applications are done through the agent portal of Blue Cross. Many of you may be shrugging your shoulders and saying, oh, it doesn't work. I'm just going to go to the healthcare.gov and do it that way. Well, you can do it that way. However, we have much more control. It's not suggested. You have much more potential of there being mistakes when you're doing it all on the healthcare.gov site. So please utilize the direct link. That is going to be the best way to confirm and make sure that you're getting paid. Now, if the client has all of the documentation that they would like, that they have a bill, for example, which many people still have not gotten a bill, then they can use this 800 number that you see on the screen. Now I'm going to type this in for everybody so everybody has it. It'll be on your chat function, and it's 800-950-3577. Now, when they call that number, it's an automated IVR system. When they call that number, they are going to need their Social Security number, and it does help if they have their bill. Now, on the bill is going to reference a case number or a bill number. That bill number is going to be alphanumeric. And when I say alphanumeric, it may be 75M263. Okay, so it's got a letter listed in there. Now, for those clients that are calling that number that have their bill in hand, what they are going to use is use the keypad on the phone, and for the letter, they're going to use the appropriate number that corresponds with that letter. So, for example, if it was a M, they would use the number 6 on the keypad. Gets a little confusing. That's why I would suggest utilizing the online platform where they can just type it. Okay. Now, your other option is going to be this. Call agent services with a list of your clients that you would like them to call back and make a premium payment. So these people who have been elevated to a level 10 fire, for example, what you would do is you would call agent services. You are going to need their application identification number in IST or their healthcare.gov application identification number. You are also going to need to provide them their preferred method of contact in the form of a phone number, as well as the date of birth. They will not be taking socials when you call Agent Service Center. And for example, if we were talking about this particular client here, I would call Agent Services and I would say, Agent Services, I have a client that needs a callback to make their premium payment. In order to make that premium payment, I'm going to give them that information, the application identification number, their date of birth, and the reason for the callback is so they can make premium payment. Those premium payment calls are going to be made. They're running about a 24 to 48 hour behind schedule as far as getting them in a queue. They will be put into a queue. The client will get that phone call, and then they will be able to make that premium payment via a credit card. They will not be able to make an APO setup at that time with a checking account. This is binder payments only. Once that binder payment is completed, then they will be able to set up the APO at a later time. But this way you can print them a temporary identification card. About 24 hours later, they can rest their mind at ease knowing that they've paid and that that policy will be issued a policy number. So there's a couple different ways for you to do it. You can make the phone call. My recommendation is save the golden tickets, save all of those people who are a level 10 fire, give them to agent services with the appropriate information. Get those calls made back to them. Tell your folks to be prepared for that phone call. They're starting those phone calls at 8 o'clock in the morning. They're running till 9 o'clock at night, and they will be making those calls on Saturdays as well. Okay, so I had a question come through while I was talking. What about clients who completely went through healthcare.gov and put in your information for the broker info? Are those delayed as well in showing in the agent portal? I have ones from October that are not showing. Yes. The applications that are done via healthcare.gov, there is going to be a significant delay. I don't think any of them are showing in search accounts because that information and that correspondence of information is not done accordingly. Healthcare.gov is not communicating the appropriate information to Blue Cross, so therefore they are not going to be in your search accounts. You would be able to print up a temporary identification card for that client, as I stated earlier, because it won't matter as long as they've made premium payment. Now, if you have that client, you can also utilize agent services to make those callbacks. But those are a little more cumbersome, and there is, believe it or not, if it was done in October, a good chance that you're not listed as the agent when that information was parsed over to Blue Cross. I know that probably doesn't make you feel all warm and fuzzy, but that's why applications done through the direct link through Blue Cross is recommended. We will be able to get documentation from Blue Cross about those applications to troubleshoot them, but that is not going to happen, during the knee heat of this battle as we're going through it now. But these systems are working better. If you're following the path and you're making sure that you're following the application process as you should be, which would be click on your individual sales tool, go to the marketplace here. It's always going to open up your secondary window, and here utilize your password that you've created on Part 2 of healthcare.gov registration process. This process works pretty seamlessly. You can do an application. You can look up an application. This is a really slick model. It works really well. If you haven't gone through and done a dozen of these on yourself right now, you need to get with some friends and family and try them. The lookup works fantastic. I'm able to look up someone else's client if we needed to, and you just really need to play with this system a little bit. Furthermore, you have to make sure that you're providing the documentation that you get here. When I'm talking about documentation, I'm talking about eligibility results. It's really important that you're providing those eligibility results to all of your clients, because many of you are going to find out that there are other things that need to be done in those eligibility results, or things that the client needs to accomplish that you have to make sure they do. Because if they don't do it, they may lose their subsidy. If they don't provide documentation, they're going to lose that subsidy. And that could be documentation of citizenship. That could be documentation of pay. Lots of different documentation that it's up to them to provide that information. Now, if you haven't sent that to your clients on applications that you've created, believe it or not, it's really simple to find it. You just come in here to the direct link, do a lookup of the person's information, and the only difference is you fill in all of this information, including the app ID. That app ID is located right on the eligibility results. If you don't have the app ID, by utilizing all the rest of the information, you can click on search and it will find it for you. If it doesn't find it for you, that means that some of this information may be inconsistent with what was done originally, and it has to be specific. Everything has to be perfect in order to look up that application. Name, spelling, address, suffix, middle name, so on and so forth. And Social Security numbers are always recommended. Now, if you are having problems with the healthcare.gov site, a lot of us say, well, what am I doing? I'm not getting an eligibility result. What's going on? What would the animals do? All of those things that are happening, unfortunately, you just got to do it over again. And you're going to have to just keep on doing it until you get that eligibility result. Now, the problem is that I want to really inform everybody and make sure that you are understanding that you are not to be messing around with the numbers because you feel that your client deserves a subsidy and it's not coming up with a subsidy. All right, you are putting yourself in a major situation that if you are trying to fudge the numbers and saying to your client, well, let's just make the numbers this so that way we can do this, and you are going to get yourself into major hot water. Okay, so answer the questions appropriately, answer them consistently, go through that process, and what it tells you is what it is. Now, a lot of you are probably coming up with situations and scenarios where the children are not being put onto the Blue Cross, and you say, oh, well, that's not acceptable. Well, actually, it is. If you understand the way that the rules work, if that child is available for Florida Healthy Kids or MediKids or Medicaid, they cannot go on the policy with you, with the parents. All right, it's a glitch in the system, and it's not really a glitch, but what you have to understand is if that family is under 218% of the federal poverty level, then those children are not going to be eligible for a subsidy. They are going to have to go to Florida Healthy Kids. Now, let's just say that you're trying to help your clients, so you think, and you say, well, let's just make your income a little bit more. Well, if you do that, then what's going to happen is that client, if that's going to happen, then what you're going to do is that client is going to end up getting a subsidy for the child, which is nice. Great. And now the child is on their policy. Now, at the end of the year, when they file their taxes and they see that that family is really under 218% of the federal poverty level, Mr. Jones is going to have to pay back all of the money that he gave or that he was given by the government in the form of that insurance because he qualified for another policy. So you will be doing a major disservice to your client if you say, oh, don't worry about it, let's make your income a little higher, we'll get your kids on the plan. They get a subsidy for the whole family, and now at the end of the year, they're really under 218% of the federal poverty level, and they didn't qualify for a subsidy. Well, guess what? They are going to call you. They are going to be standing on top of the table saying, well, now I have to pay back $3,000 because that's how much money I got. We wouldn't have gotten this subsidy, and you advised me to do so. So please be very careful. Furthermore, if you're dealing with people that are non-U.S. citizens or things aren't going accordingly, it's not working well, you're not able to get those or identify those subsidies, what you're going to need to do is pick up the phone on a three-way call healthcare.gov, and speak with them, find out what's going on. It could be a matter of that person is not eligible for a subsidy based on what their work methodology is, based on how they're making money. There could be a lot of variables in there, but don't just assume that it's broken, or don't assume that it's not working correctly. Additionally, try it again. Make sure that you're doing it a couple of times if you have to. You do it online with your customer. That is a requirement. You can't be doing a subsidy determination without your client's material knowledge. That's a major problem, and that is again a problem with the rules that you're not following. Okay, so anybody have any questions about using this direct link? And then, obviously returning to the insurer website is pretty easy. There's a button on the top here that says return to the insurer website, and it's issuer website, excuse me. And then that's how you can get back to Blue Cross at, any point in time in this application process. Let's see, a question came in. Affordable Care Act client needs to fill an RX today, has received nothing from Blue Cross, can't afford to pay for the RX. What do I tell the client? Well, we go back to the beginning. Did that client make a premium payment would be number one. If that client did not make a premium payment, then they need to follow the steps that we covered earlier. Make that premium payment. That premium payment and communication about that should have been happening long before today's call. So you could have been having that conversation with them before. If they can't afford to fill the medication, I'd ask the question of had they fill their medication before this all happened, before the Affordable Care Act. Did they have insurance? Did they cancel insurance? How did that all work? They are not going to have any option but to pay for that if they need it today because it's life-threatening. Pay for it, get reimbursed from Blue Cross after their policy is issued, but there's not much you can do if that temporary ID card is not available. They're going to have to make that premium payment through the methods that I gave you earlier. Next, is there a special enrollment period for someone who has a group loss of coverage with no COBRA option and conversion is no longer an option? No, there's no special enrollment, but annual election period is still open. So they would just enroll now with a 2/1 effective date. So they're not honoring any we're not dealing with any special enrollment periods because open enrollment is still available. We're past 1/1, so you can't get a 1/1 effective date at this point. You're working on a 2/1 effective date. So your option for a solution for that client would be write them a short-term medical policy that will get them from now until the 1st of February. Write that policy today and make sure that they have coverage starting on the 1st. Of February, that is. They can't enroll in a policy with a special enrollment period for 1/1. Now, that being said, if that client had a number of issues and they were trying to enroll and they were trying to enroll and they were trying to enroll and then they couldn't, then you can call healthcare.gov, tell them of this special scenario that they had been trying to enroll, and healthcare.gov can do the enrollment with you with a getting and possibly honoring a 1/1 effective date. However, I would not hold your breath. I would not spend 3 hours on the phone with healthcare.gov because that's about what it's going to take for you to get that accomplished. Use your time wisely, write them a short-term medical policy, and then have them covered as of 2/1. All right. Any other questions regarding the direct link? Some of the things that we've covered so far this morning, a lot of important stuff. One last thing I want to tell everybody is a lot of people have been really getting upset because they don't understand why certain people have not been getting subsidies. Now, I know that Gigi has shared with everyone some information on utilization of the Value Penguin Estimator. And you need to be utilizing this estimation tool. However, you need to be conscious if you're using this estimation tool that when we're dealing with children, when we're dealing with people that are under 218% of the federal poverty level, what I had said earlier about kids going on Healthy Kids and Florida Medicaid and Medikids and all of those options, that's really going to cause a wrinkle in this estimation tool. Also, if you're using this estimation tool and you have one person who is on Medicare and the other one that is not, that is also going to mess with the estimation tool. But the reason why I'm bringing the estimation tool up is because if you have a single individual, and let's just say that that person is, 30 years old, and they're making, $30,000 a year, and you come into this tool and you say, excuse me, and you say, well, I'm on healthcare.gov and this guy's not getting a subsidy. Why is that? Well, it's typically because the subsidy is very low or he may not get a subsidy because the cost of the insurance for that particular individual may be less than 9.5% of the income. So let's just say that we're talking about this 30-year-old male, and he's making $35,000 a year. Now, when you've done that, we've looked at these charts from healthcare.gov and these charts that illustrate what the federal poverty level is, and he's clearly about $10,000 underneath $46,000, a single man who his income is under $46,000. And you would say to yourself, oh, well, this guy deserves a subsidy because he's under that threshold. What you have to remember is that the reason that a subsidy exists is to get a client's premiums under 9.5% of their income. And for this 30-year-old man in Alachua County, the cost of the insurance is underneath 9.5% of his income. Therefore, he does not get a subsidy. And remember, it is the second lowest cost silver plan. So it may not be the policy that he wants, but there's a policy that is the second lowest cost silver plan that is underneath 9.5% of the person's income, and therefore he would not get a subsidy. So just be conscious of that. That's been throwing a lot of snags into things for a lot of folks. Also, a husband on Medicare and the wife not. These are just some areas that I've seen come up a lot as far as of confusion, and I just want to make sure that everybody's clear on that. All right, so I'm just about done with the areas that I wanted to cover today. Does anyone have any questions or concerns that I can address, and if not, that I can bring Gig onto the phone, or at least answer for her why we're not? Any questions? Excuse me. Is anybody's direct link not working? Is anybody having a problem using the direct link? Let me ask that question. If everybody could respond so I know you're awake, that'd be great. I know that probably some people are still hungover a little bit, but is anybody having a problem using the direct link from Florida Blue? This piece right here, going through it and returning back to Blue Cross. Okay, so I've got some people that are saying they're having a problem. Wendy, you're having a problem. Mine is not working. I keep on getting locked out from Marlene. Okay, great. So when you say that you're getting locked out, what you need to make sure before you really have a ton of problems and you're going through it and you're saying, okay, well, this is not working for me. Let me show you a little troubleshooting piece. So if you go in and you log in to Blue Cross, you click on the direct link, and you put in your username and your password, and then it brings you to a blank username and password screen. Then what you're going to need to do is you're going to need to go into part 2, which is portal.cms.gov, this screen right here, and log in. I would pretty much guarantee that it means you need to reset your password, because your password for this needs to be reset every 60 days. Okay? So if you log in here and then it says you need to change your password on the next screen, or it says access denied, then you have to make sure that your username and password combination here is updated. Log in, and it may ask you to change your password. After you change that password instantaneously, believe it or not, you can go back into Blue Cross, click on the White House, and this should work. So that goes for access denied. Somebody's saying you always get a black screen. Well, a black screen is usually a browser issue. So if you're getting a black screen, make sure you're using Chrome or Firefox, and make sure that you have cleared all of your cookies, and also make sure that you're not closing the pop-up window that opens up when you're doing that, and the pop-up window looks like this. So those are some troubleshooting aspects for a black screen. No problems, working fine. Mine is not working. I keep on getting locked out. So those of you that are having these issues, try a couple of those troubleshooting things that I just addressed on the YouTube channel as well. If you go to the direct link, that using the direct link actually is troubleshooting on how to do that, and try that. Now, people are saying that I'm locked out, that kind of thing. Please make sure that you try what I said now, and see how that works. If you don't know how to clear your cookies, just Google it. I can't go through how to clear cookies with everybody. Just go to Google and check on how to clear your cookies. It's a little bit easier on Chrome than it is on Firefox. All right. So, I want to thank everybody for their time today. If we don't have any other questions, I'm going to let everybody go. Again, this is the first of our weekly meetings that we'll have. What I will do is I will be speaking with Gigi on a weekly basis. So before our call, there's be all the areas that I can always really address. That way I'll address them on the call. Please contact Gig DeFalco if you have her number. You should have her number. Contact her today if you're locked out, if you're getting access denied. After you try a couple of these areas, get right back on there. Make sure that you speak with her and you get this fixed. It's important because you need to be writing business now. You need to be using these tools, and you make sure that you're using them. I'm excited to be able to work with all of you guys on a weekly basis and address all of these areas. So I want to thank everybody for their time. Happy New Year. I hope everybody has a great day. And let Gig know if you have any additional questions about being locked out. And I want to thank everybody for their time today. Have a great day and Happy New Year.